I'd like to introduce Dr. Josephine Gwynn. Josephine's been, Joe's been on with us for quite a number of presentations over the years. She's a senior lecturer at the University of Sydney School of Health Sciences, a senior research fellow at the Poche Centre for Indigenous Health here in Sydney, and a member of the Charles Perkins Centre. Her research interests are based on young Aboriginal people and their nutrition and physical activity, Aboriginal community governments of research, and Aboriginal community developed or delivered health promotion. Today, she's presenting on the next stage of translation to policy and practice of the Atrial Fibrillation project led by the Poche Centre. So, Jo, over to you.
Thank you, Tom. Can you hear me all right?
Good.
Great, terrific. I should add cardiovascular health to my list now. I've been involved with the atrial fibrillation study for 6 years. This was an initiative of Kylie Gwynn. Today I'll be just walking you through the studies and about our next steps. But first I'd like to acknowledge the traditional owners of the land that I live on and I'm presenting from, the lands of the Awabakal people. Now that this town is known as Newcastle, someday we may go back to the original name of this area and for the river. So Newcastle and the Hunter River. And I'd like to acknowledge the traditional owners of the land, elders past and present, and any Aboriginal people here, all Aboriginal people here today. I went for my little walk, Tom, just out the back door and could see down over the Hunter River. And when the British came at the end of the 1700s, they saw coal lying around what is now Nobby's Island, was called Nobby's Island. It's now connected artificially to the mainland. They also saw kilometres of oyster middens, metres deep, and proceeded to mine that for lime for Sydney Town, the building of all the buildings in Sydney. And they also saw at night canoes on the river with women fishing and little fires burning within the canoes. And they also saw what was seen around Australia, the park-like appearance of the land around the river and around the beach. We now understand, non-Indigenous Australians now understand that this was due to very careful land management by Aboriginal people over tens of thousands of years. And it's wonderful that our eyes are rising and opening to this fact around Australia. So I'm going to talk to you about the atrial fibrillation studies. I'll just share my screen and hope that you can see this. All good, Tom? Can you see the screen okay?
Yep.
Yep, good. Thank you. So this series of studies, as I said, was an initiative of Kylie Gwynn some 6 years ago. And I'm going to talk to you about the studies that have occurred over the past 6 years and where we're heading to. The team is enormous, as you can see from the number of names in the acknowledgement section there. And this consists of people from the university, from Poche Centre, from Poche Centres in South Australia, or it was in the Northern Territory, or in Western Australia, as well as communities around Australia. So I'd like to acknowledge all the participants who took part in the large prevalence study that we completed. And this was people across Australia, the 3 jurisdictions of West Australia, Northern Territory and New South Wales. I'd like to acknowledge all of the people who participated in this study, from the Noongar and Yamatji people in West Australia, the Majuri people from Northern Territory, and of course, Wiradjuri, Dunghutti, Bundjalung, and so forth from New South Wales. So this AF studies, and before I just go to describe this, just for those of you who haven't seen any of this presentation previously at the showcase, atrial fibrillation is the most clinically significant heart arrhythmia internationally amongst all populations. It is where the heart just sort of wobbles, it doesn't beat properly. And in fact, one of our participants, I think, said something like, it's the heart is dancing to a different tune or a different beat. which is quite a nice way of thinking about it. Often it's asymptomatic, people don't know they have it. It does result in a high risk for stroke, and which is one of the rare, so that's a very serious effect of atrial fibrillation, and it can be treated, AF can be treated quite easily. So nothing was known about the prevalence of AF in Aboriginal communities and the impact of it, hence the work. So it started with an international collaboration, and here the evidence was gathered around what existed or didn't exist around knowledge of AF in Indigenous communities internationally. Kylie then led the design of the protocol for the large study that we then conducted. It was a co-designed protocol with the communities from around Australia. We looked at two things. We looked at the prevalence of atrial fibrillation across Australia and the feasibility and acceptability of screening for AF using a small ECG device on the back of a mobile phone. Once we completed those studies, and I'll explain their results after this slide, we conducted a small rural case study to look at what was happening around the knowledge of AF and the sharing of information about, particularly about medical records in a community that took part in this study. We've talked to key informants, and we've started looking at solutions to the device and the medical record compatibility. And a student of Kylie's has undertaken a systematic, or a realist review, really, more than a systematic review of AF screening Indigenous peoples in high-income countries, and come up with a terrific model and framework that will guide our work from here on. So the prevalence and feasibility studies aimed to estimate the prevalence of AF in Australian Aboriginal people over 45 years and determine the feasibility and acceptability of the device. And here there's a couple of pictures of the device. You can see the little paddle or steel finger device that you put your fingers on at the back of a mobile phone, and you download an app, and that gives you a 30-second ECG from a single lead. And you can see whether it's a normal result, unclassified, or possible AF. And if you get classified or possible AF, then you get a 12-lead ECG. 619 people participated across 17 sites and 3 jurisdictions. As we did the single lead ECG, we did it at community events in rural areas, remote areas, sitting outside under the tree, sitting outside the multi-purpose facility. It was a very versatile tool, and we just went with whatever the appropriate approach was in the community at the time. We delivered a brief intervention on heart health, and then interviewed 23 staff from across 11 sites about the feasibility and acceptability and their views on using the device for the purposes of screening. So results were that we conducted the largest and first national and community-based study of AF in Australian Aboriginal communities. We did not include the Torres Strait Islander communities, didn't include Queensland, and no one identified as Torres Strait Islander in the study, so I'll be using the term Aboriginal from here on. A higher estimated prevalence of AF was found at a younger age, those greater than 55, than for non-Aboriginal Australians. And we found that it was feasible and acceptable to use the ECG device. We recommended that the guidelines for AF screening be introduced and include that screening occur at a younger age, that is greater than or at 55 years and over. Currently, for the general population in Australia, it's at 65 years, and no specific guidelines exist for Aboriginal and Torres Strait Islander people. We also recommended the inclusion of AF screening in the annual Aboriginal Torres Strait Islander health assessment. So having done this, we thought then we should talk to key stakeholders about their views of these recommendations. So we were fortunate to get funding for a summer scholarship student at the Charles Perkins Centre. And together with us, she interviewed 12 stakeholders, 6 Aboriginal people, 6 non-Aboriginal people. There were nurses, researchers, policymakers, community liaison officers, and across all geographic locations. 3 themes emerged: that screening age must be younger, Guidelines to support the lower age of screening are necessary to highlight cardiovascular disease burden in Aboriginal communities and legitimise AF screening. And a greater emphasis is required on prevention. The barriers to screening were identified as low rates of health assessment uptake, and this was a bit of a surprise to me. I wasn't aware how low the health assessment uptake was. The follow-up and management of AF once diagnosed. Now, this is a systemic issue in the health system. And continuity of care and staffing, particularly in rural and remote areas. And identification of Aboriginality. The key stakeholders identified this as one of the barriers. So the screening opportunities were seen to be, the unanimous verdict was with the heart health check that this was a natural place for the AF screening to occur. The Aboriginal Torres Island assessment, yes, it's a logical inclusion. However, it's very packed with current assessments and clinical requirements. So it may well just overburden that particular health assessment and the procedures required. Other opportunities were possibly the annual flu jab program and just opportunistic screening. So when we were screening, we attended Christmas lunch with a group of elders from one of the communities, and an community event that took place in 2 or 3 communities this occurred. So there's opportunistic opportunities particularly with a portable device like the ICG. So the conclusions we came to, which inform our next steps, consider these 3 important things: that there must be improved efforts to ensure culturally appropriate pathways of follow-up and management. The flexibility in the approach to screening is really important, and it's tailored for each community context. And the geographically and culturally accessible medical services must exist, and they must have procedures and tools to support screening. So we are doing now, we've got another Charles Perkins Centre summer scholarship student who's working with us to find a solution to compatibility issues between the ICG device and community-controlled health organisations' medical record systems. We're working with Pfizer to produce a series of educational seminars for medical practitioners on AF in Aboriginal communities. And we're going to start applying for grants. So we're putting a bid into the current MRFF cardiovascular health grant. We're tentatively calling this the EASY study. Thank you, Kylie Gwynn. She's great with these sort of acronyms. Early atrial fibrillation screening in Indigenous communities. And this will be to co-design and pilot procedures to sustainably support AF screening in New South Wales Aboriginal communities. So the emphasis in this study, when we get it funded, will be to really work out the practicalities of how screening can feasibly and easily occur within the busy environment and often complex environment of an Aboriginal community-controlled health organisation. I'd just like to say thank you again to all the participants across Australia who've participated in this study. We've built up a really quite a strong foundation of work, and I'm looking forward to continue to working on this project until I or it finish. Thank you.
Okay, thank you, Jo. Now, Yvonne.
We just have a comment from Connie. Thanks for this research presentation. It's cool how this device is able to provide vital health information instantly and easily in various locations that suit the community. Jo, I really like the lovely acknowledgement of country and history that you shared, as do I. I like that too, Jo.
Oh, thank you. Now, I think it's really important, and this is all to do with my teaching, but I've become aware that so many people just do not know anything about the history of places, and knowing about your place is so important. So, thank you.
And we have no other questions, Jo, but again, thanks for the update and where we're at with the project. And yeah, I'm sure if Bo could have got online, he would have given his 2 bobs worth in what he's doing internationally on that project as well, or what we did earlier.
Well, Kylie's, I don't know if she's still online, but she was involved with that earlier international work.
Yeah.
But I know that I don't think she is still online. the Sud's work with the framework that he's developed has had an international collaborative approach. It's been supported by that international collaboration. And there are still papers emerging, and there's work starting to be done in the United States as well amongst Indigenous communities there. So slowly that's gathering.
Yeah, thank you.